Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do when you have failed a medical coding job assessment test. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this email from a viewer and I'm gonna read it and then we're gonna talk about it. So here we go. All right, so the viewer says, "Hi Blue, I took an outpatient auditing assessment test. The auditors told my recruiter that I didn't pass the test. I don't understand how I didn't pass. Do you have a video with inside information on employer assessment tests for coders?" Here's the thing, guys. There is no such video. First of all, it's unethical to do that kind of thing to employers. Every employer is different. There is no standard assessment test for employers. Every employer is going to test their people on what is most important to their facility. And so that's the first thing that you have to know, all right? The second thing is dependent on their pass-fail rate. Sometimes people will make a 90, and according to the employer, that's a fail because they need them to be at 95%. So it really all depends on what their pass-fail rate is. Now, you can ask the employer, hey, what did I score, if they tell you that, you didn't pass. Sometimes they will tell you and sometimes they will not. Sometimes they will share the results with you on, what did you get wrong, and a lot of times they won't. So it really all depends on the employer themselves. They have no obligation to you as far as like to tell you why you didn't pass or, what the deal was. But here's the thing. I see a lot of people, and this happens a lot on my channel. People will reach out to me for tutoring or for resume rewrites, and we start talking about like when was the last time they studied and they're looking for a job and that kind of thing. And a lot of them will look at me like I got three heads. Like, oh no, I haven't been studying, and well, I kind of been reading over the book. When I hear I kind of been reading over the book, that tells me that no, you haven't. And it's okay. You don't have to, answer to me. But I'm here to tell you that when you complete school, when you pass your certification exam, you still need to be working on your coding even when you are looking for a job, because, you still need to maintain your skills. It can be a long time before you get a job. Some people wait 6 months, some people wait a whole year. And if you haven't been coding or practicing the coding in a whole year, that stuff starts to get rusty. And a lot of times people will go through these fast-paced medical coding programs that I tell y'all not to do, but y'all still do them anyway. But these 6 month and less programs that promise that you can pass a test, yeah, I can train you to pass a test. According to these schools, they can train you to pass a test, but it doesn't mean that you actually understand and grasp what's going on. This is why I always tell you, if you're looking for a medical coding school, make sure that it's at least 9 months, 9 months, 12 months, or 18 months. I don't care how fast you get through the school. What I care about is your grasp of the material. Anybody can get through a school fast, but can you grasp what you're doing? That's another thing, okay? So continue to study, all right? Don't take it personally. These tests are, individualized to the place, and depending upon if it is a specialty place, sometimes like if you are applying for a sports medicine clinic, right? And it's a lot of injury diagnosis, a lot of orthopedics and things like that. So you want to make sure that you are up on all of that before you sit for their test or before you start applying with them, because those are the types of questions they're going to need to know that you understand, right? Same thing if you are getting hired on with pediatrics and that kind of thing. That's very specific. So you can really kind of start looking in those sections of the book and start looking at what are the available codes. Read over the coding guidelines to make sure so that you're really preparing yourself for this job. It is all about how much effort are you going to put in. And before you tell me, well, Blue, I've been putting in all this effort. Okay, again, if you're studying, if you are reading your coding guidelines, if you are still practicing with your workbook, it's going to set you up for better success than if you're not and you're just out there trying to get a job as fast as you can and not studying, okay? Because they need to know that you're competent before they hire you. And having a credential is not enough. because again, these employers know the deal. They know that there are these fast-paced medical coding schools that are out there, and they're rushing people through these programs. So a lot of these people that are brand new are not competent enough to stand on their own out there in the real world because they don't have enough training, and then that employer is going to get stuck training that employee, and that's not what they need. Because if they're trying to hire somebody, they need somebody who can essentially be dropped in with very little training and just set off to go, you know. So that's something that you have to consider when you're out there looking for a job. Employers will hire new people, okay, but it does take some effort to get in. And yes, a lot of them expect you to have experience, and a lot of them expect you to know all of these things. And how are you supposed to know all these things if no one will give you a chance? This is why I tell y'all, apply with the temp agency. When you apply with a temp agency, they don't care that you don't have experience. You have skill, and that's what they're going to market to these employers that are needing somebody to fill in, okay? So if they are filling in for assignments for medical coders, you know, these medical coders, you know, they're going to be out for a certain amount of time. Sometimes it's because they're on sick leave. Sometimes it's, you know, maternity or paternity leave, you know, whatever the case may be. And they need somebody to come in and fill in for that person. So it's going to be weeks long, you know, sometimes it's months long, you know, it depends on, you know, what the contract is, right? So if you can get in that way, you're still making those connections. You're still, you know, filling in on a spot, and everything that you are learning there can go on your resume as experience. And now you're starting to get some traction. So that's what you really want to shoot for when you're brand new. You know, a lot of people get kind of stuck in that mentality of, well, there's no entry-level positions, because there's never going to be those. They're going to be few and far in between. If an employer was to say, hey, we have entry-level positions, they would get inundated with thousands of resumes, because people are looking for those. They think they need to find those in entry-level positions. And when in actuality, you can apply for any medical coding position as long as you have the training, right? So how to prepare yourself for these employers and things like that. You're not going to know what's on those tests, right? You're not going to know until you get in there and they start giving you those scenarios. But again, if it is a specialty type clinic, then you can use common sense. Hey, this is an orthopedic clinic, so I need to look up the orthopedic codes, and I need to go over the orthopedic guidelines. Same thing if it's peds, same thing if it's cardio. That way you can be well-rounded and aware of all the things that are available. You can even go to specific websites for different specialties. Like if it's for a respiratory clinic, you can go to the American Lung Association website and just kind of look and get a feel, get familiar with the things that affect the lungs and affect the respiratory system. So that way you can get yourself even more ready, all right? And then, so if they ask you, you know, how do you plan to look up answers, or how do you plan to look up your research, you know, then you can say, well, you know, if you're applying with a respiratory clinic, I've been looking at the American Lung Association website and everything else that you can learn from that, okay? And there's a ton of them out there for every single specialty. And you can start by simply Googling the specialty that you want to code for. And you'll see a lot of different associations pop up. And so that's where you really kind of want to start learning to do your research that way too, okay? It also is it's a good conversation piece when you are in there trying to apply and get these interviews going and things like that, because they're going to know that you've taken the time to do your research. To me, if I'm a hiring manager and I see somebody who does that, that's music to my ears, because this isn't somebody that is going to be running back and forth asking me, what's the answer? When I can read and you can read. So, you know, we need to learn independently. That's a lot of what medical coders do. You know, this person, I feel bad because they don't know what was wrong. And they said that it was the recruiter. I don't really recommend going through recruiters because recruiters that I have seen on LinkedIn are really kind of a waste of time. They're really kind of looking for a specific person who meets a certain amount of parameters to, send resumes out for these employers. And they get a commission. A lot of times they get a commission on bringing in these candidates, these very specific candidates. So this is why I say go to the temp agency and get hired on with them, so that way they can be an advocate for you. Because if you're working, they're making money. And that is the goal, is for you to have a job. And that's what they will fight for you to have. Recruiters, it's about, okay, who do you know? And so I don't know. And I'm sure there's some great recruiters out there, don't take it offensively. But what I'm saying is this, be out there, be proactive, go to the temp agency. Don't get all worked up about these people that are saying, oh, we need this and we need that. Okay, if they need all of those things, there's a ton of other places for you to apply. I'm just saying. So be ready, be prepared. It all goes back to the resume and them you being able to grab their attention with a really good resume. A lot of people don't take resumes very seriously. How are you supposed to get a call back if you are not putting out a good resume, right? So that's the thing that you have to do. If you don't want to write your own resume, because I have a ton of resume advice videos on my channel that I've done, all you have to do is look into the spyglass and put resume tips and they'll all pop up. There's a ton of resume writers on LinkedIn. I'm a resume writer myself. My rate is in the description box below. So if you're interested in that, make sure that you check that out. And that's just something that, you have to be ready for. Okay. And along with looking up, just whatever it is, whatever specialty it is. And if you are coming from a place where you've been a coder before and you still failed a test, think about this. Sometimes you're carrying over old habits from your own facility, that this facility may be a little bit different from the facility that you came from. So that you got to kind of keep in mind too. It's not personal, it's just maybe old habits. So that's something that be prepared, all right, if that's happening. This is why I always tell you guys to continue to look up the coding guidelines, continue to read them at least once per year when you become a veteran coder, so that way you can be all up on the changes. Because sometimes people will say that we do this way over here at our facility, and they never look up the current guidelines, they never look up the current rules, and they keep doing the same thing over and over again. And when in actuality things have updated and they just never changed their way of doing things. And so because of this, stuff can be marked as wrong, when it comes to audits, when it comes to taking new assessment tests. So that's something that you got to think about when you're in those situations. You don't ever want to get caught into old habits and, this is the way we do it. This is the way we do it over here. And people will say, well, at my old facility, no one cares about your old facility. They care about what's going on in this facility. That's what they care about. And so that's the thing. It sounds a little harsh, yes, but that's just the truth. That's the matter of the whole thing, because every place is different, and every place accepts different insurances, and sometimes certain facilities have special rules that they have to apply to their coding. So, and it's okay, but you'll learn some of those other things in time. But a lot of times it's just the basic things that once you've been out of school for a while, if you're not continuing to practice, it can leave your memory, So continue to practice. Don't get so cocky that you think that, because I have a string of credentials after my name, I know it all. I've seen many people who have a string of credentials who don't know basic things, or can't expand on the things that they do know according to their credential line, right? They're supposed to be experts in these things, and I can ask them a basic question and they can't even answer me. So if that's you, make sure that you go back and you're reviewing all of these things, because what you say and what you do says a lot about what you know, right? So I'm just saying, put it all together, guys, and it'll be all right, and there's going to be times when you may just miss one, and to them that's a fail, so again, don't take it personally if you don't pass an assessment. But if you do happen to find out, what it is that you did miss, if they were gracious enough to say, well, you missed all this and this was wrong and that was wrong, thank them. Make sure that you thank them and say, okay, then that's where you need to improve, and buckle down and really start to study on those parts, so that way it can start to make sense to you and it can start to be a little bit easier, and it's not something that you're going to run from. There's a lot of times that coders get very complacent. Once they get kind of proficient in something, in one kind of subject, they kind of want to stay there because that's what they're most comfortable with. Now, I have been with orthopedics and podiatry for quite a few years now, but I know that I can go anywhere because I can. I've done it before. I've done pulmonary. I've rescued pulmonary clinic. I've rescued neurology. And so and I was still in orthopedics doing that. But it's because I'm a studier, I'm a reader. And that's something that we have to be as medical coders. This is not just data entry. There's a lot of people who foolishly think this because, and I say foolishly because medical coders have a huge responsibility to look at documentation, to be able to abstract what is happening there in the documentation, and applying the correct codes, applying the guidelines, and applying the correct procedures. Because again, if you're able to do that, the provider is taken care of because they don't have to worry about their codes, and the patient is paying the appropriate amount. Okay, it goes back to the patient is very important, because if you're selecting the incorrect codes, you could potentially financially impact that patient. And that's something that you really need to make sure that you're careful about, okay? You don't ever want to financially impact the patient and because you made a mistake, okay? I'm just saying. So I'm going to wrap this one up. Best of luck to you if you're out there and you're taking these assessment tests. It's part of the deal, guys. Don't be offended if you don't pass. If you don't pass, then that means you got to buckle down and start studying harder, all right? There are workbooks out there. The workbooks that I recommend are in the description box below, guys. All of my contact information is also in the description box below. If you don't understand something, if something doesn't make sense to you, reach out, find a mentor, find a tutor. I am a tutor myself. My rate is in the description box below. There's a ton of tutors on LinkedIn that you can reach out to too. So that's just something else out there. All right, so I'm going to wrap this one up. Thank you guys again for joining me. Please like, subscribe, and share, and I'll see y'all again. Bye.